Hello everyone, I'm Jingxiang Zhang and I come from University of Wollongong. And my topic is predicting readmission following hospital treatment for patients with alcohol-related diagnosis in an Australian regional health district. And now let's see the background. Firstly, unplanned hospital readmission within 28 days after discharge is an indicator of medical quality. Since 2006, the Australian government has been monitoring the 28-day readmission rate to gain more insights into the quality of care. And reducing the rate of unplanned hospital readmission is a way to improve the quality of care and reduce the costs. And next, alcohol use is thought to be associated with a generally higher rate of hospital readmission, and identifying the predictors of readmission in patients with alcohol use disorder is an important step to prevent readmission. And next, I will introduce several machine learning methods which are widely used in the medical field. The first is logistic regression, which is a generalized linear model used to solve binary classification problems using a given set of features, which can be continuous, discrete, or a mixture of the two types, and a binary target. Logistic regression calculates the linear combination of the input and passes it through the sigmoid or logical function. Therefore, the output variable of logistic regression is between 0 and 1, which can be interpreted as the classification probabilistics. And the competitive advantage of this method is easy to use, thus it's often used. And the next is random forest. Random forest is an effective prediction tool. Based on the theory of asymmetrical learning, it completes the learning task by constructing and combining multiple linears, thereby improving the generalization ability of the classifier and enabling the algorithm to accurately learn simple and complex classification functions. And the random forest can achieve good performance on various datasets. And the last is classical support vector machines, which are binary classifiers. The support vector machines are among the best off-the-shelf supervised learning models that are capable of effectively dealing with high-dimensional datasets. And next, we go to the research gap. Although there have been many studies on the factors that affect patients' readmission, to the best of our knowledge, no existing study has specifically focused on hospital readmission for patients with alcohol use disorder. And so the study aims to identify the predictors of hospital readmission in 28 days for patients with alcohol use disorder, and to predict the patient's hospital readmission status within these 28 days by conducting machine learning on data extracted from electronic medical records. Now I will introduce the data. The data were obtained from the Illawarra Health Information Platform managed by CHRISP, and the SQ's approval was obtained. And then let's say the table. 40 identified datasets were extracted from IHIP. They are emergency department dataset, hospital dataset, drug and alcohol service dataset, and the mental health dataset. And the sample of each dataset is huge enough, containing tens of thousands of records. And next, how to identify the alcohol use disorder patients. The alcohol use disorder patients are defined as the patients with the following diagnoses in emergency department and hospital datasets. And then let's see the verbal selection. and we chose 12 predictor variables for examinations through literature review and the correlation test, including characteristics variables such as age group and gender, and hospitalization variables such as the model separation with the length of stay. And next, we define the readmission in 28 days as the outcome variable. It has two values, yes or no. All additional records of these patients from the hospital datasets were extracted, and the data was further processed following these rules. Firstly, the records of patients who were admitted only once were dropped from the analysis. And secondly, the planned reanimation records were removed to minimize the bias in prediction results. And thirdly, admissions that resulted in patient deaths were removed. And fourthly, for admission with multi-episode, the information of the first episode was kept, representing the entire admission. And next, the records of each patient were sorted according to the admission date and time. And last, the variables with more than 30% missing values, or the variables with the same value in all records were removed. And because the missing observation of medical data were usually difficult to estimate. And next, we go to the data analysis. Firstly, a binary logistic regression will be used to determine whether an input variable has a relationship with the output variable. And next, we plan to apply the random forest model to the variables existing in the dataset and the baseline, and compare it with the model after adding new variables to determine whether the addition of new variables improves the prediction accuracy. And we will apply 6 machine learning algorithms and compare them with the baseline. And last, we plan to use tenfold cross validation to validate each prediction model. And we will assign the accuracy measures highest importance because the main goal of the study is to find a prediction model that best predicts the variables. And last, let's say the expected results. And we expect to define the factors affecting hospital readmission within 28 days of patients with alcohol use disorder through this study. And identifying these predictors are of great clinical importance, and they are beneficial for reducing readmission rates going forward. In addition, we plan to establish a high-performance predictive model based on these predictors to accurately predict the patients who will be readmitted in 28 days. This will help to better match patients and treatment methods, or establish a social support network to reduce the burden on hospitals. Okay, that's all. Thank you.